So the Imperial AHSC now has 4 members. So the original 2, Imperial College and ICHT, Imperial College Healthcare Trust, and the Royal Marsden and the Royal Brompton both joined in July of last year, 2016. So we've been running just over a year now with our 4-way AHSC. And the excitement for me is really being able to build substantial critical mass around cancer with the Royal Marsden, and particularly around cardiology and respiratory medicine with the Brompton. And the opportunities to bring us closer together, particularly through informatics, are now immense. So we're entering an area where there is perhaps slightly less innovation in terms of new medicines, but there's extraordinary innovation in terms of the ability to look at data and use the analysis of health data to start to improve outcomes for our patients in particular diseases. So it's been the case that we've been collecting these data in the NHS for many years, but it's been really challenging to be able to analyze them in a way for benefit. And what we've done is we've taken some exemplar projects. The one that's most rapidly moving forward is around lung cancer, where we can combine data from patients at the Royal Marsden, at the Royal Brompton and ICHT, and start to use Imperial College powers in computational analysis to understand better how patients are preventing and how we may be able to get earlier diagnosis of this group, but also stratify those patients more quickly for the new therapies which are coming in the field of oncology. It was very clear when we looked at the expanded AHSC and reviewed what the priorities were, that we had good provision for training doctors in research capacity and ability, but we were really not training the rest of the workforce at all well in this area. So the largest single workforce is nurses, and we have now a very ambitious program for training nurses up to PhD level and beyond, and using the power of all the organizations working in alignment with our new Clinical Academic Training Office, CATO, to facilitate getting more and more nurses and indeed other allied health professionals into PhD programs. So I see an immediate benefit over the next 2 to 3 years in dramatically enhancing research training opportunities for all staff across the AHSC. Imperial College is a focused, research-centered training organization with obviously a small number of faculties looking at engineering, physics, physical sciences, chemistry, mathematics, and a business school, and medicine. And I think that focus allows us to reach deeply into the college for that expertise in these areas, and then use to drive collaboration with health workers across the trust organizations really effectively. So over the next 5 years, I think the area where I really want to move into rapidly, where we've not been very busy so far, is around machine learning and artificial intelligence. And that's got to be in 2 areas. Firstly, around radiology, where the trusts produce very, very large numbers of images every year, but we've not really worked with the computer scientists and mathematicians to extract the maximum possible information from that extraordinary repository of information linked to the phenotype, the diseases which the patients have. And I think with the advances in AI and machine learning which are getting together with industry, which are happening worldwide, that's a real opportunity. I think the second area is around pathology, where again the traditional approach to reading slides for histopathology tissue sections hasn't changed much really in the last 90 or 100 years. And again, it's going to be machine learning of digitalized images, which is going to give the most progress the most quickly. So we need to be digitalizing our pathology images now and reaching out across the university to really get that expertise to play on how those images could be analyzed more quickly, more effectively, and perhaps more deeply.